tonight, we're learning more about a serious reaction to Pfizer's vaccine right here in the U.S. The third known case worldwide and the first allergic reaction to the vaccine in the U.S. affecting a healthcare worker in Alaska. So joining us to tell us more about this is our chief health editor, Dr. Partha Nandi. Good afternoon, Dr. Nandi.
Good afternoon, Glenda.
Well, in the case of this third reaction, did the person also have a history of allergies?
So, Glenda, this is a serious information. It's not clear if this person did or did not have a past history of allergic reactions before they received the first dose of the Pfizer's coronavirus vaccine. All we know at this point is that a healthcare worker had a serious allergic reaction yesterday, and she remains hospitalized for observation and is currently in stable condition. So while we wait to hear more information, it's really a good time to talk to your doctor, your healthcare provider, to let them know if you have any kind of allergies.
So, Dr. Nandi, while we wait to learn more about that situation, there are people in high-risk groups who are especially anxious to get the vaccine. Is it possible to get vaccinated early?
That's really the million-dollar question, isn't it? Everybody kind of wants to know. And unfortunately, I can't say with certainty if people who are in the high-risk groups, that they will get vaccinated early. We're just getting started, right? And at the moment, there's a limited supply. The White House has said that they can immunize 20 million in December, and 30 million in January, and 50 million in February. Here in Michigan, right, our first batch contains just over 84,000 doses. The CDC and the ACIP, the Advisory Committee on Immunization Processes, right, they said they recommended a 4-phase rollout. In phase 1A, that includes healthcare workers like myself and nursing home residents. 1B includes essential workers, right, and critical essential workers in critical industries. And then after that, phase 1C are people who are high risk of developing COVID-19 and recommend to get vaccinated. It was pointed out that some phases may even begin even when other phases haven't been completed yet. So this opens the door so folks who are at high risk to get vaccinated a little sooner than they might be than folks in the earlier phases.
So, Dr. Nandi, you've often talked about advocating for your own health. Should people who are concerned advocate for themselves to be vaccinated early?
I talk all the time about being your own health hero, right? Advocate for yourself. And in this case, I absolutely think so. You should advocate for yourself, make your health your number one priority. So it cannot hurt to advocate to get vaccinated early. So what do? Talk to your doctor, let them know, and make sure your electronic health records, right? The records that show if you're at high risk are up to date, and any underlying medical conditions are included. You could also discuss which category you may fall into and how you may be able to get vaccinated quickly once the vaccine is available to that group. But remember, please be patient because things are just getting worked out. Even physicians like myself may not always have detailed answers. And as we get more details about this person in Alaska, we'll give it to you right here on WXYZ.
All right, Dr. Nandi, thank you. We appreciate you this afternoon.
My
and
pleasure.
If you have a coronavirus question for the good doctor, email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or Twitter, and we'll get it right to him.